Before we begin, if this is the first time you visit to our channel, you consider to subscribe. Trust Doctor Channel. Dr. Abed El Wahed. Benefits of breastfeeding: your pregnancy and baby guide. It's never too early to start thinking about how you're going to feed your baby. But you do not have to make up your mind until your baby is born. Some of the benefits of breastfeeding are: your breast milk is perfectly designed for your baby. Breast milk protects your baby from infections and diseases. Breastfeeding provides health benefits for you. Breast milk is available for your baby whenever your baby needs it. Breastfeeding can build a strong emotional bond between you and your baby. Formula milk does not provide the same protection from illness and does not give you any health benefits. Health benefits of breastfeeding for your baby. Breastfeeding has long-term benefits for your baby, lasting right into adulthood. Any amount of breast milk has a positive effect. The longer you breastfeed, the longer the protection lasts and the greater the benefits. Breastfeeding reduces your baby's risk of infections, with fewer visits to hospital as a result. Diarrhea and vomiting, with fewer visits to hospital as a result. Sudden infant death syndrome, SIDS. Childhood leukemia. Obesity. Cardiovascular disease in adulthood. Giving nothing but breast milk is recommended for about the first 6 months, 26 weeks, of your baby's life. After that, giving your baby breast milk alongside solid foods for as long as you and your baby want will help them grow and develop healthily. Breast milk adapts as your baby grows to meet your baby's changing needs. Health benefits of breastfeeding for you. Breastfeeding and making breast milk also has health benefits for you. The more you breastfeed, the greater the benefits. Breastfeeding lowers your risk of breast cancer, ovarian cancer, osteoporosis, weak bones, cardiovascular disease, obesity. Busting some breastfeeding myths. Myth: it's not that popular in this country. Fact: more than 81% of women in the UK start breastfeeding, and 17% of babies are still being exclusively breastfed at 3 months. Myth: breastfeeding will make my breasts sag. Fact: breastfeeding does not cause your breasts to sag, but pregnancy hormones can stretch the ligaments that support your breasts. Wear a well-fitting bra while you're pregnant. Myth: people do not like to see women breastfeeding in public. Fact: most people do not mind. The more it's seen, the more normal it will become. The law protects women from being asked to leave a public space while breastfeeding. Myth: formula milk is basically the same as breast milk. Fact: almost all formula milk is made from cow's milk. It can contain bacteria, which is why it's vital to make it up with water that is hot enough to kill any bacteria, 7°C. It does not protect your baby from infections and diseases like breast milk does. Myth: some women do not produce enough breast milk. Fact: almost all women are physically able to breastfeed. Early, frequent feeding and responding to your baby's cues give you the best start to establishing your supply. See, is my baby getting enough milk? Myth: if I breastfeed I cannot have a sex life. Fact: there's no reason why breastfeeding should stop you having sex with your partner. Your breasts may leak a little milk while you're having sex, but you can try feeding your baby beforehand or wearing a bra with breast pads inside. Your vagina may feel a little drier than usual because of your breastfeeding hormones. Using some lubricant and taking things slowly will help. Myth: breastfeeding hurts. Fact: breastfeeding is a natural way to feed a baby and it should not hurt. If you experience pain in your breasts or nipples, it's usually because your baby is not positioned or attached properly. Ask your midwife, health visitor or a breastfeeding specialist to watch a whole feed to help spot the problem. Myth: my nipples are flat or even inverted, so I will not be able to breastfeed. Fact: nipples come in all shapes and sizes. Holding your baby skin to skin after birth will help them find the best way to attach themselves. Your baby breastfeeds, not nipple feeds, so if they can get a good mouthful of breast, they should be able to feed perfectly happily. Myth: babies do not need breast milk once they start solid foods at about 6 months. Fact: breastfeeding still has lots of benefits for you and your baby after 6 months. It protects them from infections and there's some evidence that it helps them to digest solid foods. It also continues to provide the balance of nutrients they need. The World Health Organization recommends that from 6 months, children should begin eating solid foods while continuing to be breastfed for up to 2 years or longer.